The shocking truth about glaucoma is that it is a silent eye disease. You probably won't know you have glaucoma until it has advanced to the late stage, or if it is randomly detected during eye screening. In our last video about glaucoma, we delved into its definition, the risk factors, various types, and preventive measures. If you missed that crucial piece, just click on the 3 dots at the top right side of this video to catch up. Today, we're taking the next step in our exploration by discussing the symptoms of glaucoma, including early warning signs and symptoms specific to each type. We'll also cover the available treatments when they are recommended and share some valuable tips on surgery recovery. So make sure you stay with us until the end. And if you find our content helpful, please remember to like this video and subscribe to our channel for more insightful updates. By the way, I am V and welcome to the best health channel on YouTube where we talk about everything related to your health and well-being. Let's dive deep into each of the 7 early symptoms of glaucoma, providing you with the details and examples needed for a thorough understanding. Gradual loss of peripheral vision. This symptom is akin to looking through a narrow tube where your central vision remains clear, but the sides begin to fade. Imagine walking in a crowded street but not being able to see people approaching from your sides unless they move directly in front of you. Seeing halos around lights. This manifests as bright circles surrounding light sources, making night driving or looking at streetlights challenging. It occurs because the eye's fluid doesn't drain properly, causing a buildup that affects your vision. Eye redness. It's not the typical redness from a lack of sleep. This is more persistent and can be accompanied by other symptoms like soreness. It occurs due to increased pressure in the eye irritating blood vessels, causing them to appear more prominent. Eye pain. This can range from a dull ache to sharp pains in or around the eye, and might be accompanied by blurred vision. It's not just discomfort. It's a sign that the pressure inside your eye is at a level high enough to cause significant discomfort. Blurred vision. Suddenly the text on your phone or signs on the road aren't as sharp as they used to be. This isn't about needing new glasses. It's a blurriness that doesn't improve with blinking or squinting, indicating fluid buildup affecting your eye's lens. Headaches. These aren't your average tension headaches. They're often focused around the eyes and may worsen in the mornings. It's as if the pressure inside your head matches the pressure in your eyes, leading to a persistent throbbing pain. Nausea and vomiting. When combined with the other symptoms, these could indicate an acute angle closure glaucoma attack where eye pressure spikes suddenly. It's like your body's alarm system telling you something is very wrong and it's not just a stomach bug. Recognizing these symptoms early and consulting with a healthcare professional can significantly impact your treatment's effectiveness. If you experience any of these symptoms, especially in combination, seek medical advice promptly. Let's break down the symptoms based on the 2 primary types of glaucoma: open-angle glaucoma and angle closure glaucoma. Understanding these can help in recognizing the condition early and seeking timely intervention. Open-angle glaucoma. Open-angle glaucoma is the most common form of glaucoma, progressing slowly over time. Initially, it might be like a silent thief in the night, often showing no symptoms until significant vision loss has occurred. However, as it progresses, symptoms may include gradual peripheral vision loss. Initially, it might not be noticeable, but over time, you might find it harder to see objects at your sides. This is akin to the edges of your field of vision slowly fading away or getting darker, making activities like driving more challenging. Tunnel vision. In advanced stages, your direct line of sight might remain clear, but it's as if you're looking through a narrow tube. This severely limits your ability to navigate your surroundings and can significantly impact your quality of life. Angle closure glaucoma. Angle closure glaucoma, less common but more urgent, can develop slowly or suddenly. The symptoms for the chronic, slowly developing form are similar to those of open-angle glaucoma but can also include eye pain and redness. The increase in eye pressure can cause significant discomfort, often described as a sharp or throbbing pain in or around the eye, coupled with a noticeable redness. Blurred vision and halos. You might notice your vision suddenly becomes blurry and lights appear to have rainbow-colored rings around them, especially in low light conditions. The acute form of angle closure glaucoma is a medical emergency and can include symptoms such as severe eye pain. The pain is more intense than with open-angle glaucoma and can be accompanied by nausea and vomiting. It's not just discomfort, it's a severe, debilitating pain that demands immediate attention. Sudden vision disturbances. This can include significantly blurred vision, seeing halos around lights, or even sudden vision loss in one or both eyes. Headache, nausea, and vomiting. These symptoms, particularly when occurring together with eye-related symptoms, indicate a rapid increase in eye pressure that requires urgent medical care. It's important to recognize that angle closure glaucoma can develop very quickly, necessitating immediate treatment to prevent vision loss. Regular eye exams are crucial for detecting the signs of glaucoma early, especially since the symptoms can be subtle or non-existent in the early stages. If you experience any of the mentioned symptoms suddenly or severely, seek medical attention immediately to prevent long-term damage. Before we move on to treatment options, if you find the video educating or have learned new things, please like and consider subscribing. It encourages me to make more videos like this. When it comes to treating glaucoma, the primary goal is to lower intraocular pressure, IOP, to prevent further vision loss. Treatment can vary based on the type of glaucoma, its severity, and individual patient factors. Here's an overview of the main treatment options available. Medications. Eye drops. The first line of treatment for glaucoma usually involves prescription eye drops. These medications help reduce eye pressure by improving fluid drainage from your eye or decreasing the amount of fluid your eye makes. Examples include prostaglandin analogs, beta blockers, alpha agonists, and carbonic anhydrase inhibitors. Patients must use these as directed even if they do not experience any symptoms to maintain eye pressure at a safe level. They're recommended when a patient is diagnosed with glaucoma or is at high risk for disease progression. These medications can lower eye pressure either by reducing the production of aqueous humor, the fluid in the eye, or by improving its outflow from the eye. Laser therapy, laser trabeculoplasty. For open-angle glaucoma, this procedure can increase the outflow of fluid from the eye, reducing pressure. It involves using a laser to open the drainage holes in the trabecular meshwork of the eye. This is typically used for open-angle glaucoma when medication alone is not sufficient to lower eye pressure or if a patient cannot tolerate medications due to side effects. It's also considered for patients who are not compliant with taking their medication. Let's take a closer look at how the surgery works. The laser surgery process. First step is preparation. Before the procedure, the eye is numbed with eye drops to ensure comfort. In some cases, medication may be given to help the pupil remain in an optimal position during the surgery. Next step is the procedure. The patient sits facing the laser machine, similar to sitting at an eye examination slit lamp. A special lens is placed on the eye to focus the laser precisely on the target area. For open-angle glaucoma, the laser is aimed at the trabecular meshwork to improve drainage. In angle closure glaucoma, a laser creates a hole in the iris to enhance fluid flow. Laser surgery for glaucoma is quick, typically lasting only a few minutes. After the procedure, patients can usually go home shortly after the procedure, though they will need someone to drive them. Vision may be blurry for a short period after the surgery, and there may be some mild irritation. Here are some pre-surgery tips to help you get ready for the surgery. Discuss medications. Inform your doctor about all medications and supplements you're taking, as some may need to be paused or adjusted. Arrange for transportation. Your vision may be temporarily blurred or impaired after the surgery, so arrange for someone to drive you home. Skip eye makeup. Avoid wearing eye makeup or creams on the day of the surgery to reduce the risk of infection. Follow pre-procedure instructions. Your eye doctor may advise you to use specific eye drops or medications before the surgery. Ensure you follow these instructions carefully. Eat lightly. While you may not need to fast before laser eye surgery, eating a light meal beforehand can help you feel more comfortable. Post-surgery tips that can boost recovery. Rest your eyes. After the procedure, rest your eyes for the remainder of the day. Avoid strenuous activities that could increase eye pressure. Use prescribed eye drops. You may be prescribed anti-inflammatory or IOP-lowering eye drops after the surgery. Use these as directed to aid recovery and reduce the risk of complications. Wear eye protection. Protect your eyes from bright light and physical harm. Sunglasses can help outdoors and avoid rubbing or pressing on your eye. Attend follow-up appointments. It's crucial to attend all follow-up appointments so your doctor can monitor your IOP and the healing process, making adjustments to the treatment as needed. Be alert for changes. Contact your eye doctor immediately if you experience severe pain, vision loss, or any signs of infection post-surgery. Early detection of complications can significantly impact your recovery. Laser surgery can be an effective way to manage glaucoma and protect against vision loss. Following these pre- and post-surgery tips can help ensure the best possible outcome from your procedure. The next treatment option is laser iridotomy. Used primarily for angle closure glaucoma, this treatment creates a small hole in the iris, allowing fluid to flow more freely in the eye and reducing pressure. Recommended for angle closure glaucoma, particularly in acute cases to quickly relieve eye pressure. It's also used prophylactically in patients with narrow angles to prevent angle closure glaucoma. Laser cyclophotocoagulation targets the middle layer of the eye to reduce fluid production, lowering eye pressure. This option is often considered for advanced glaucoma. This is often used for advanced glaucoma cases or when other treatments have failed. It's also a consideration for patients with certain types of secondary glaucoma. Glaucoma drainage devices, GDDs, involves implanting a small tube to help drain fluid from the eye, relieving pressure. GDDs are often used for patients who have not had success with traditional surgery or have certain types of glaucoma, minimally invasive glaucoma surgeries, MIGS. These procedures aim to reduce eye pressure with fewer complications and a shorter recovery time compared to traditional glaucoma surgeries. Lifestyle changes and home remedies. While lifestyle changes and home remedies cannot cure glaucoma, they can support your overall eye health and potentially enhance the effectiveness of other treatments. This includes regular exercise, a healthy diet rich in nutrients like omega-3 fatty acids and antioxidants, avoiding excessive caffeine, and maintaining a healthy weight. It's also crucial for patients to closely monitor their condition and adhere strictly to their prescribed treatment plan. Emerging treatments. Research into glaucoma treatments continues to evolve, with new drugs, laser technologies, and surgical techniques being developed. These aim to offer more effective, safer, and less invasive ways to manage glaucoma, providing hope for better outcomes in the future. It's essential for individuals with glaucoma to work closely with their eye care professional to determine the most appropriate treatment plan for their specific condition. Regular monitoring and adjustments to the treatment may be necessary to protect against vision loss effectively. In conclusion, glaucoma's impact on vision can be significantly mitigated with early detection, appropriate treatments, and patient diligence. From medications and laser options to surgeries and lifestyle modifications, managing glaucoma effectively means being informed and proactive. Advancements in care offer hope and improved outcomes, but success hinges on regular eye exams and adherence to prescribed treatments. Take charge of your eye health. Stay informed, schedule regular checkups, and engage with the latest in eye care. And if you found this video helpful, please give it a thumbs up. Subscribe to our channel and hit the notification bell to stay updated on all things related to your health and well-being. Together, we can keep your vision sharp and clear.